O Lord, take my love and let it flow in fullness of devotion to Thee. O Lord, take my hands and let them work incessantly for Thee. O Lord, take my soul and let it merge in one with Thee. O Lord, take my mind and thoughts and let them be in tune with Thee. O Lord, take my everything and let me be an instrument to work. Om Shanti, Shanti, Shanti.
My humble salutation in the lotus feet of our beloved Lord Bhagavan Sri Sathya Sai Baba. And I am extremely grateful to Bhagavan Sri Sathya Sai Baba and thankful to Sri Sathya Sai Organization UK to give us this platform to reach you. Probably most of you have joined this program before. During the COVID time, we were monthly on the various pressing subjects in the medical field, and which has benefited several people. This time we are trying a different format altogether. It is a live session where people will ask the question. We have got a wonderful facilitator, Dr. Meera Gondhia, and a great presenter and a master in his own subject who is going to conduct this webinar. Dr. Meera Gondhia is a clinical lead GP and educational trainer at an inner city London practice. She has a special interest in tropical and reproductive medicine and undertake quality improvement projects. Dr. Gondhia is also the clinical lead for palliative medicine at the surgery, looking after patients with long-term conditions, including dementia and supporting end of life care. Dr. Gondhia has been a Sai devotee since childhood and held various roles in the Sai organization. She also assisted in many Sai medical camps and has left a lasting impression on the host and the patient wherever she has served. I hand over to Dr. Meera Gondhia, who is facilitate and introduced our main speaker today.
Thank you, Dr. Upadhyaya. That was a very kind introduction. Okay, so as Dr. Upadhyaya has explained, this is the first time we've tried something like this, a live question and answer session. And we have a specialist. We're very lucky to have Dr. Krishnaiah with us today. If anybody has any questions or comments, please, you can pop it up onto the chat or perhaps just raise your hand using the icon. And Dr. Krishnaiah is happy to take the questions as we go along. So I'd like to, first of all, introduce Dr. Krishnaiah, and just to inform all of you that this meeting will be edited for live streaming on Tuesday, the 3rd of October, just so that everybody is aware. So Dr. Raj Krishnaiah, he qualified as a doctor in Bangalore, India. He started his career as a junior doctor in psychiatry in Surrey and completed his higher training in London. Dr. Krishnaiah has gained experience in a variety of subspecialties, which have included adult, old age, child psychiatry, forensic and learning disability psychiatry. He actually specializes in neurodevelopmental disorders such as autism spectrum disorders and ADHD, so attention deficit hyperactive disorder too. Currently, Dr. Krishna is working as a consultant in the learning disability psychiatry and is also the clinical lead for medical undergraduates. Dr. Krishna and his family are Sai devotees and active workers at the Sathya Sai Centre in Slough in Region 2. So without further ado, I'm really happy to welcome Dr. Krishnaiah to take us through this journey of dementia. Over to you.
Thank you very much, Meera. That was really kind of you. Well, as everyone heard, my name is Dr. Raj Krishnaiah. I'm a consultant psychiatrist. So people will be wondering, this chap is a neurodevelopmental psychiatrist. What is he talking about dementia? Well, actually, I am a neurodevelopmental psychiatrist, but my main interest on top of it is dementia. I was running a dementia care services in Maidenhead in Berkshire in 2018, 2019. So I'm also a special visitor for Office of Public Guardian, where lasting power of attorney happens all the time. And I do see patients with dementia on a weekly basis very regularly. So This is one of the fascinating subject I would love to talk about. And especially now, as we all growing older and living longer, it is important for us to understand a bit more of dementia. I'll try to keep it as basic as possible today, but please do ask me any questions, raise your hands, as what Dr. Upadhyaya was saying, and I'm happy to answer any of your questions. Okay, so now I'll try to share some of my slides. The way I try to do is, as I'm going along with the slides, I'm just going to play some YouTube video also, so that you have a picture of what I'm talking about. Yeah, that's me in there. And so to begin with, let me start with a video where you can capture what dementia is in 1.5 minutes.
It's quite normal to become forgetful as you get older. But some people develop more serious problems and worry that these might be the first signs of dementia. There are many different reasons why you might be having memory problems, things like stress, depression, and vitamin deficiencies. There's also something called mild cognitive impairment, a mild memory problem that doesn't significantly affect your life. Dementia is memory loss that gets progressively worse. It can make it hard to make plans, carry out day-to-day tasks, and communicate with others. You might find it hard to recall recent events or particular words, or to remember the names of things. Dementia also affects a person's mood, judgment, and personality. Alzheimer's disease is the most common cause of dementia. Damaged tissue builds up in the brain, forming deposits called plaques and tangles, which can make the brain cells around them die. Vascular dementia is usually caused by blood vessels becoming damaged or blocked. This can lead to small strokes or brain cells dying. At the age of 65, about 1 in every 20 people will have dementia. By 80, about 1 in 5 of us will have some degree of dementia. Your genes, lifestyle, and medical conditions do play a part. Conditions such as strokes, heart disease, and high blood pressure, and lifestyle choices like smoking, drinking, poor diet, and lack of exercise can all make you more likely to develop dementia. If you are worried about your memory, you should make an appointment to see your GP. They'll do some simple memory tests and might organise some blood tests too. If you have dementia, it's important to stay active, both physically and mentally. Make lists and use a diary to help you remember appointments. Keep your mind active by reading and doing puzzles. Make sure you eat healthily and get plenty of exercise. To find out more about dementia, visit the Royal College of Psychiatrists website.
So as you guys heard about what dementia is and what things can be done around it, dementia is a general term that's used across medical fraternity to a group of conditions which affects memory. So you may think everyone loses memory, so why dementia? Why there should be a name? There is a reason why it is, which I'll come to it in a few moments. All of us know sometimes as we get older, and even at a younger age, for different reasons, we struggle to memorize or struggle to remember things, and we kind of misplace objects and things all around. Is that dementia? Not necessarily. So what is it? So dementia, again, as it's a part of normal aging process, where it's a group of related symptoms and signs that you would notice as we grow older, mainly affecting memory. And depending upon the types of dementia, it can have other areas of life being affected as well. So there are different types of dementias, as you see here: Alzheimer's dementia, vascular dementia, mixed dementia, Lewy body dementia, frontotemporal dementia, alcohol-related dementia, which is again called by another name called Korsakoff's dementia. And it is also noticed that in some people who are mainly vegetarians or who have some deficiency of vitamin B12, it's commonly seen that they also develop some memory issues. But these people, when they take vitamin B12 supplements, they do feel a lot better. So not necessarily that's main cause, but it is associated with vitamin B12 deficiency at sometimes. So it's important for us to understand these different type of dementia. Not all dementias are Alzheimer's dementia. So dementia is an umbrella term that is used for conditions which affect people's memory, and this memory affecting their day-to-day life. And this effect that causes in their day-to-day life has to have impact on their way of living. It can be their social situation, it can be their work, it can be their within their family. So then we look at whether it is dementia or not. If it is not affecting, it is not necessarily dementia. So it is very important that the symptoms that which we are going to talk in a few minutes need to affect a person's life in all these areas. Okay, so symptoms, what are the symptoms? So the commonest symptom is memory loss, which is quite often seen. But again, depending upon the type of dementia, let's say Alzheimer's dementia. In Alzheimer's dementia, the most common problem people notice is memory loss. So people tend to remember their past. Let's say, you know, I have a person around 70 years old who comes for dementia screening and we diagnose with dementia. What ideally I would have noticed is that he would talk everything so beautifully, so crisp about his past, his childhood, his marriage, his work, his employment. But if I ask him about the recent things, he would tend to forget. Let's say he has, whether he or she had a breakfast in the morning, what breakfast they had, or yesterday, what did they do? Or that weekend, you know, that beautiful weekend that they had, what did they do? They'll struggle to remember those. So the short-term memory, what we call, is disturbed. And when you're having a conversation with them, they usually tend to forget words. So they struggle to make complete sentences. So they may say, instead of a long sentences, they may be saying a sentence and in between they will get lost with words and they will switch to another sentence. So which kind of frustrates them, thinking that why am I not able to complete a sentence? And you ask them a question and they tend to forget what you have asked and they keep asking you the same question and again. And but the important thing is when you ask them, do you have any memory problems? They will absolutely be fine. They'll say, no, I have no problem. And why are you here? I don't know. My son, my daughter just asked me to come and see you. I really don't know why I'm seeing you. I have no problem. I'm fine. Look at me. The judgment is affected. Their movement sometimes is affected. So all these things has an impact on their day-to-day life. Let's say they're driving, they're wearing clothes. It has an effect on some of the people with Alzheimer's dementia, for example. They tend to wear shirts or their tops inside, outside, front to back, anything of that sort of. And they struggle to wear the trousers and they have issues with remembering the time of the day. Sometimes by afternoon, they may say, it's getting night now, I need to go to bed. And in the morning, 4:30, 2 o'clock, they can wake up and say, well, I'm ready for my work now. You know, so they have this disorientation with their time as well. And some people in this age group, they may even think that they're still working. And so in the morning, first thing in the morning, they'll kind of wear their clothes and then get ready to go to work, when in fact, they're not working. So these are the common situations that you come across when you see the patient for the first time. And you also notice that their social relationship, for example, their daughter, their sister, brother, they tend to forget their names initially. And then slowly this goes towards forgetting their faces. So they misinterpret their names sometimes because they get confused easily with one person to another person. And they may misidentify people. So they may even call their wives as their mother, because they can relate their mother as they've gone back to their childhood. Just talking about one simple example that I had this patient who has a lovely wife, really lovely wife, and he treats her as his mother. And every time he wants to go to the toilet, he says, he calls his mother and, "Mommy, come, I need to go to the toilet." And she has to go with him. If not, he won't go because he's scared to go to the toilet. Because possibly he is 8 or 9 years old in his mind. So he wants his mother to be with him. It's quite a difficult, actually, for a carer. But these things keep getting worse, and the symptoms also keep adding upon. Sometimes we also notice that patients with dementia, depending upon, again, type of dementia, they tend to hear voices. When I say hearing voices, I mean that they can see someone talking to them. The normal presentation is that they can hear people in the loft talking to them, or they may hear some, the creaking noises that can make in the loft. So they misinterpret that as someone talking between themselves or someone trying to talk to them. And sometimes in some type of dementias, they even see objects. They can see little children in the bedroom or in the loft. They can visualize that someone is there in the loft or in the bedroom or in the garden, for that matter. So any of these things can happen. So it can happen in the initial stage, or it can happen at a later stage. So obviously all these things, symptoms that I just mentioned, can affect the person's life. Sometimes possibly you would have heard or you would have seen, I'm not sure, I don't know how many people have experience of caring or supporting people with dementia, or even heard of dementia. One example I can give is that, some person with dementia, he or she goes in front of the mirror and they can't recognize themselves. Absolutely not. They will think that the person is completely a different person. I'll play the video in a minute, how some people get so distressed that they can't identify themselves as who they are, and they recognize the person in the mirror as a different person, and they talk to them as if it's a new person to them.
Dr. Krishnaiah, just on that note, actually, someone has asked, why can a dementia patient not recognize their own house, or perhaps they don't recognize the house that they live in? And there's a question around how we support patients going through this.
Mm-hmm. Yeah, that's a very good question. And this is what I was trying to explain. Usually what happens is, as in the initial stages of dementia, depending upon kind of dementia, the memory issues may vary. They may remember where they are, they may remember where they live, but as the memory gets worsened, it goes back. Let's say in 2023, I live in Windsor, and slowly as my memory goes down, in 2017, my memory goes back to Datchet, where I was living. And if my memory get worse even a little bit more, I was living in Egham, that memory goes to my living arrangements in Egham. And as the memory gets more worse, the memory goes back to St. George's in London, where I was living. And then slowly that goes back to Guildford. And then slowly it goes back to India, where I was living. So that's how it goes back slowly. So it all depends upon the type of dementia that a person suffers from. Let's say if someone has a stroke, that happens all of a sudden. And if dementia is because of that, which in case it's called as vascular dementia, and that depends upon which area of the brain is damaged. So their memory is affected, memory or any other aspect of brain that's damaged, that part of the brain functions are affected. So that's how the presentation of dementia is. So the next question was, how do we help and support them? Which I will be touching upon a little bit later. Just to give a brief idea that it is quite difficult. So some of the strategies that we teach is that have a nice photograph of their family, have a nice photograph or have a photo album of the past few years, their middle age, their childhood, all things together in their bedroom or in the house, so that they can orient themselves nicely. And important is to have a nice calendar, to have a nice wall clock, so that they get oriented to time, they get oriented to place, and making sure that if they have a house, they have a picture of their house. So then they'll start able to relate together, which we call as reminiscence therapy. But that happens as their memory gets worse. I hope I answered that question. So if I may, shall I move on, Meera?
Sure. There was one more question, possibly from the same person, but just they asked if you could talk about what sundowning is and how do they know that a patient with dementia is sundowning?
Okay, this is a very challenging question, because people do get confused a lot about this. It's like the person with dementia, as I mentioned, they get disoriented with time, place, and person. So as the sun goes down in the evening, they get so disoriented that they find very difficult to accept it. So then they start becoming challenging, they can start becoming more restless, they start becoming more agitated. Sometimes you can reassure them comfortably, and most of the time it leads to some behavioral problems. So, and hence we try to advise them that their environment is made in such a way that it's quite calm and more relaxing for them, so that the changes with the time should not affect them that much. So this can be done by these environmental measures, and also by some medications. Yeah, these are the common symptoms that you can see on the slides, which usually people with dementia present with.
Conhece esse homem?
Qual?
Esse homem que está lá no espelho?
Quem é, Sr. Manuel?
Eu conheço? Sim.
Não.
Não conheces?
Não conhece? Olha lá para o espelho, Sr. Manuel.
Para o senhor.
Quem é esse senhor?
O doutor está a procurar se conhece daquele senhor que está no espelho. Não, espera a gente para ir para o espelho.
Não conhece o senhor?
Não conheces?
Não.
Não conheces?
Aquele é o Sr. Manuel. É você que está no espelho. Olha lá. Para o espelho. É você. É. Não conhece? Não?
As we mentioned, we got different types of dementia. Vascular dementia is a type of dementia other than Alzheimer's dementia. Vascular dementia is usually caused by a stroke, usually caused by diseases like diabetes or hypertension or hypercholesterolemia, which is like a high cholesterol in the body. So mainly what happens in this situation is that the blood vessels that supply the brain gets clogged up, like the water pipes getting clogged up with all the debris and other things. And so then there's no water supply. So same thing happens here, where the brain stops functioning as those brain cells die because there's no supply of blood there. So depending upon which area of the brain is affected, the symptoms are seen. It's just like a remote control, you know, a remote control, you'll have like 9 to 10 switches, 9 to buttons, and whichever button doesn't work, that function is not there. Similarly, if it is affecting the front part of the brain, the symptoms are seen front part of the brain. The back part of the brain is affected, then the symptoms which is common from the back part of the brain, those symptoms are seen. So there is no specific symptoms of vascular dementia as such seen. It all depends upon which area of the brain is affected. But generally it is seen that they have muscular or musculoskeletal issues like pain or movement problems, and it also can affect their mood. Their memory is affected, but not as much as Alzheimer's dementia. Yeah, so having problems with thinking problems, this is very common with Alzheimer's dementia. Thinking problems, difficulty with attention, planning, reasoning, and mood changes. This is very common in vascular dementia as compared with Alzheimer's dementia. Yeah, this is before that, I think I should mention that the most commonest dementia that you come across is the mixed dementia, which is a combination of vascular and Alzheimer's dementia. The reason I'm saying is because most of the people, as they get older, they have, diabetes, hypertension, cholesterol. This obviously can cause some small blood vessels blockage in the brain. We call angiopathy, and because of which those brain cells die over a period of time. And those symptoms happen. And as we all know, as we get older, the brain also shrinks. So combined together, it's called as mixed dementia. And the symptoms also merge, as I explained, Alzheimer's and vascular dementia. Symptoms are also mixed. Lewy body dementia. This is quite a unique type of dementia, I have to say, where usually people keep falling over. The commonest thing is that as soon as they stand, they can't keep the steadiness, and then they fall. And they become very slow in any of the movements that they do. It's like very similar, like a Parkinsonism, if anyone knows of Parkinsonism, very similar to that. But speciality of this is that they can see unusual things which people can't see. For example, if I say Mr. Smith has Lewy body dementia, the way he presents is that he comes to me and he says, "Oh, Dr. Raj, you know what? Yesterday I saw like almost 60 small children in my bedroom." So that sort of visual hallucinations people usually have. And they're quite confused all the time. So they're either drowsy or very, 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 very sleepy. This frontotemporal dementia, this is another type of dementia where usually this is more common in men than female, where the frontal part of the brain is affected and also the temporal part of it. But generally, the people present more problems with the frontal part, which is responsible for our executive functioning, which controls the way we behave on a day-to-day basis. Let's say like our personality is controlled by the frontal lobe. The way I talk in this presentation is managed by the frontal lobe. But if I have frontal lobe issues, then I'll be talking so fast, I'll be so disinhibited here, I'll be talking unnecessary things here, I can be talking about things which are not necessary or appropriate in this meeting. This is very common in frontotemporal dementia. Men and women usually get sexually disinhibited, and they can even talk so much that they can start lying things, or they may assume things what has not happened. So this is very common in frontotemporal dementia. If I put it in a very common layman terminology, the filter, all of us have filter, yeah? That filter is lifted, there's no filter. So that's what it is. So we are without any filter. Yeah, so these are all the symptoms that I was mentioning earlier. So as the dementia starts, dementia, there's no specific age as such nowadays. Usually we see more than above 65 years age, and as the age increases, the risk of dementia also increases. Well, having said that, that doesn't mean people less than 65 years old don't get dementia. They can get dementia, where we call as young onset dementia, or YOD, young onset dementia. And the causes of young onset dementia can be multiple. So we look at that person very, very carefully, do a lot of investigations, do a lot of checks to see what's the reason why this person at a very young age has developed dementia. Their presentation is very similar to this. And again, they take different names as a different type of dementia, as I already mentioned. So now, as this dementia progresses, the symptoms also progress. So it may start with just a memory problem, or it may start just with some personality changes. It can lead up to where they need full personal care, they need full mobility care, they don't understand what you're saying, they can't speak properly, the speech is completely impaired, they can't recognize who you are, they need completely 24/7 care, which can be supported either at home or in a specialist nursing home. So it varies from this to that. So it all depends upon how advanced dementia the person has. So how long does this take to happen? This is a difficult question to answer if someone is thinking of asking, because as such, there's no set criteria, but depends upon how the person is. Let's say a person with no physical problems like diabetes, hypertension, cholesterol, no falls, no infection, nothing, they usually live longer and their quality of life is much, much better. But if someone has, let's say, diabetes, smoking, no activities, hypertension, and cholesterol, then falls, and then repeated hospitalization, then the advancement of dementia is very fast. That means the quality of life is impaired very, very quickly, and they don't live longer. Even if they live longer, their quality of life is really, really affected. Anyone has any questions at this stage?
We've had quite a few come in through. So actually, on the topic of young people, there was a question around what are the symptoms that the younger patients tend to get, and how can we slow down those symptoms?
It's quite interesting question. Young people do get dementia. Nothing to worry that not everyone will have dementia. All of us are forgetful these days. Our life is so fast. We all want to be perfectionists now these days. And so we don't concentrate on certain things. So we do have memory problems at times, but that doesn't mean dementia. So these memory problems with a young onset dementia, there should be some validity behind it. For example, in the family, someone will have dementia, or they may have some physical health issues with them, or they may have had a stroke, for example, or they have had some neurological conditions. Then there is a possibility of that. Otherwise, just purely young onset dementia is quite unlikely. If someone is worried about their memory problems, and if these memory problems or their personality change, for example, is affecting their day-to-day functions, and of course, they can pick up a phone and ring their GP to seek some advice around it. But you need to look at the background of that person. As I said, family history of dementia, any neurological conditions they have, or they had a high, for example, someone's diabetes is so uncontrolled, or someone's hypertension is so uncontrolled. So there can be, TIA, I'm sure a lot of people here will understand, where they have a small mini strokes in their brain. So in those conditions that can have, but otherwise it's less likely.
Thank you. There was another question around hearing loss and dementia. So are they linked, and will wearing a hearing aid on a consistent basis help reduce the decline?
That's a very, very interesting, very, very good question, actually, which I was supposed to talk a little bit later, but it is important, like all of our senses are very, very important in dementia, like our vision, like our hearing, how I feel on touch, all these things are very, very important. Yeah, someone said about hearing problem. Yes, it is very important to check their hearing and making sure that their hearing is perfect or like near enough, and wear a proper hearing aid, and their vision is perfect or at least near enough. So we do check all those things before we diagnose with someone with dementia. We check their hearing, we check their eyesight. For example, someone having tinnitus, some tiny noise in their ears. In those conditions, people tend to hear voices, as I was talking earlier. So that can affect their concentration, that can affect their attention, that can make them imagine or hear voices when there's nothing around. But that does not necessarily mean that they got dementia. So we need to check with their hearing to make sure that their hearing is not impaired. And same thing applies to eyesight as well. There is a specific condition which we call as Charles Bonnet syndrome, where in that condition where there's completely blind and they start imagine things, and it is very, very similar to dementia. That's a very good question who's ever asked. Yeah, so it's important for us to rule out visual problem and hearing problem. Any questions?
Yeah, in fact, talking about hallucinations, there's a couple of questions around that. So perhaps I'll pair them together. One is along the line of what type of hallucinations happen in dementia. And then we have another question. I'm not sure exactly what the question is, but they've said someone keeps talking about the past, especially those who have passed away, and thinking they're alive and they may be coming back. And also another example of when watching TV, they think that person is talking to them in reality. I wonder if you could perhaps expand on that.
Yeah, absolutely. That's very common presentation with people with dementia. As I said earlier, we have different types of dementia. Their hallucinations also depending upon the type of dementia. Let's say Alzheimer's dementia, you can see anything, everything you can see. And in vascular dementia, usually you start seeing, you imagine seeing things. In frontotemporal dementia, is very less of any of these hallucinations. Lewy body dementia, specifically, you see objects as if so real. And, you know, someone was saying, like, you know, watching TV, they see as if, like, you know, the TV program is happening, and as if, like, you hear as if they're talking to you. That's exactly happens in Lewy body dementia. And it can happen in Alzheimer's dementia too. Giving some examples, Lewy body dementia. I happened to see a person, not this year, last year, with Lewy body dementia, when he was describing such a beautiful things as if something has happened in his life. But actually, when I was talking to the carer, then they said, no, it is not in his life. It's all what has happened on the TV, because he talks to the TV, and he feels that the TV is talking to him as well. So these symptoms can happen in Lewy body dementia often. And in Alzheimer's dementia, as I said before, they can hear voices as if, like, you know, someone is talking to them, either through the walls or through in their attic, or someone outside. They do believe very strongly. And not just this, and they also can believe what we call as delusions, where they strongly believe in certain things which you can't shake. So these are all can be part of dementia. And in vascular dementia, now it all depends upon which area of the brain is affected. Let's say if someone has a stroke and they had a brain cells dead in at the back of the head, then they'll have more of visual hallucination. If this part of the brain is affected, then they'll have more of hearing hallucinations. That's called as auditory hallucinations. Yeah. And tell you what, another example, very, very interesting example. You know, someone was talking about their childhood, and sorry, I didn't catch that full question, but I can relate to it, because I saw one Punjabi lady, this somewhere in Watford. So I was asked to see her as a second opinion, because they felt the doctors were treating with very high medications. And the allegation was that she is hallucinating, she's presenting with severe challenging behavior, but actually she's not. But the care home said, like, no, she is very challenging, she's shouting, screaming, and, you know, whatnot. So they find very difficult to manage her. So I went to see her. Although I don't understand Punjabi fully, but, you know, working with lots of Punjabi people, I do understand basic Punjabi now. So I went into the room, to be honest. When I went to the room, she went back to her 10 years old age. She went back to her 10 years old age, and she's talking to her two siblings. She's talking to her chacha, she's talking to her uncle, she's talking to her auntie, as if like something normal happening, you know, and like she's responding to her uncle, like who's shouting at her, you know, and she's shouting at the uncle, and the uncle shouting, and the sister, she's shouting. You feel like as if the scene is happening in front of you, you know. So she's living there. She's completely blind, yeah? She's blind, and she lives, all the bed rails are up, on both the sides, and she's in the bed, but she screams so loud that you do feel like, oh my God, this is too much now. But that is not a major issue. She's just living her life going back to 9 or 10 years old age. So this is a very typical presentation as they get older and their dementia advances. Hope I answered to that question that person asked.
Thank you. There are a few more. I don't know, because in the interest of time, we've probably got about 15, 20 minutes left.
Yeah.
There's a lot of questions around support. And I know that you've got a few slides that cover that in detail. Just one more, actually, if you don't mind, before we move on. You mentioned about vascular dementia, that somebody has asked if diabetes acts as a catalyst for the onset of dementia.
Yes. diabetes, hypertension, they all can be they can be the causative factors, and they can worsen the type of dementia too. Their lifespan or their quality of life of people with dementia is purely affected by these factors. So that's why we kind of I'll come to them when I'm talking to the in the management aspect briefly, then I will be touching upon those subjects. Yes. I mean, just giving one example, I had one just on Friday. I saw this patient who had he was absolutely fine. He had mild dementia. He was managed. And last week I got an email, not last week, on Tuesday, I got an email from the carer saying that, his behaviors are so worsened, so that he needs to be, his medication needs to be reviewed. So when I looked at it, I saw that he had a simple fall, and his blood sugars were so high that he couldn't manage, and he had a fall. And because of that fall and because of the diabetes, his behavior got so worse, and his dementia will deteriorate so quickly in his case. So that's an example for that.
Yeah, life. Okay. So you mean something to me. That lady, I think I know. Yes. I think that is my mother. You think that's your mother. Yes. Either way, I believe I know her. Okay. From somewhere. And you know that you're safe around her and that she's a good person. That's how I feel around her, yes. Is that how you feel around me? Yes. Okay, well then I guess it really doesn't matter who you feel I am. As long as you feel safe around me and you know that I love you and you love me, that's okay with me. I do feel that way. Okay. In my mind and in my heart, you're my dad. And you will always be my dad. And if that's okay with you. Yes, that is. What I don't want to hurt you. You're not going to hurt me. No matter what you think, you are not going to hurt me, Dad. And that's just what I've always called you, as Dad. But if you'd like me to call you something else, I will, if it makes you more comfortable. I can call you Scott. That's my name. Okay, how about I'll just call you Scott then? And you call me Bailey. Okay. Deal? How do you feel with that? Does that hurt? That doesn't hurt my feelings at all. I love you, Scott. I love you too. We're family. We are. In my heart, we are. And that's what we are in my heart too.
This is quite touching, to be honest. And whenever I see patients, and especially the family members, going through this, and when I'm seeing a patient in front of a daughter or wife, and when they see this, and when I look at them, the tears just come out, and sometimes you become emotional too, and it's so hard as a professional. Personally speaking, I struggled to do old age when I came to this country, because I was getting very emotional, and that's why I didn't want to specialize in old age before. And then as I continued to be in this country, it started becoming much stronger and able to handle this much better, because back home, I wasn't seeing any patient with dementia, but here I used to see on a day-to-day basis. But it's quite emotional as they get older, and you see that, your mom or your dad are so strong that they brought you up, and now suddenly they can't recognize you, they can't remember who you are, and then they talk different things. It's really heart-touching. So this is another video, and after that we are ahead. We are within time. We got 10 more minutes, Meera.
And do you know my name? Sebastian. Do you know who I am?
Who you are? You're lovely carer.
Carer? What if I told you I was your son?
You sound like my son is Sebastian.
I'm your son.
But I'm your mum.
You are my mum.
Yeah, you're my son.
I'm your son.
Funny.
It is funny.
Sebastian.
No, I am Sebastian.
That's right. No.
Yeah.
Yeah, your name is Sebastian, and my son is Sebastian.
No, I'm your son, Sebastian. What do you find funny?
Oh, just I've been seeing you for a long time, my son.
That's true. Hello.
We meet Sebastian.
Don't know where, don't know where, but I know Sebastian some sunny day. He's smiling through, just like Sebastian always do. But I know we'll meet again some sunny day. So why'd you please hello, Sebastian?
Mom, tell them all.
What's
my name?
your name? Mumsy.
No, but what my name?
Ingrid.
Yes.
Oh.
They'll be
Happy to know we're singing a song, singing this song. We'll meet again on the way, on the way.
Great part to meet Sebastian some sunny day, because we love Sebastian very much.
So yeah, so this is very commonly seen on a day-to-day practice in our practice with people with dementia. Very, very, very common. And it's quite heartbreaking that they can't remember who you are, but they're quite jovial. But this can be not jovial all the time. It can change. So now there's another condition called mild cognitive impairment. This is the starting part of dementia. This has been seen in the recent times, not before. In the recent times, this concept has come, is called as mild cognitive impairment, or MCI, where people tend to have less or memory problems, but it's less than what you see in dementia. So the main difference between MCI and dementia is that in MCI, it's not affecting the person's day-to-day life. He or she is still able to manage their day-to-day life with less difficulty. So once this goes beyond where that affects so much that they can't manage, then it becomes dementia. So it's very important that we screen for mild cognitive impairment, and we usually tend to follow it up, maybe once in 6 months, depending upon how severe they are in mild cognitive impairment, or maybe in a year's time. For sure, we will review them in a year's time, and when, if at all, we come across that person having mild cognitive impairment. So this can again get worse when someone gets admitted in a hospital, because we have seen people as we get older, even us, like, you know, when we are in an OT or in an operation theater or outside operation theater after an operation, we just tend to get confused. So this becomes even more worse when you get older. So the diagnosis is not quite straightforward. When you have problem, usually you won't recognize that you got memory problems. Usually others who recognize that you got memory problems, friends, family members tell that this is going really in a wrong direction. I think you need to seek help. So that's how the referral comes. It comes through the GP, knock the door to the GP, and the GP does a mini scale on people. And then if they feel that it needs to be referred to the memory clinic, they will do the referral to the memory clinic, where they come and see an old age psychiatrist or a nurse, where we do something called as cognitive testing, and we have a series of tests that we do, which is like an open door questions. And people may ask, like, for example, someone coming from Romania, someone coming from India who doesn't speak English, how would you use these cognitive scales? Well, in that case, what we do, we have a specific questionnaire which is used for people who have less education or zero English education. And that scale we use, and then we use that as one of the screening tool. And on top of that, we also use CT scan or an MRI scan, depending upon the availability or depending upon if the consultant needs. But that's not the necessary tool that's needed. It's important that the doctor see the patient and get history, or like speak to the family members or the carers or the relatives to get better understanding of how that person has been. So all this information put together, then we come out with diagnosis of dementia. Yes, we do certain blood tests to make sure that they don't have vitamin B12 problems, they don't have vitamin D problems, they are not suffering from syphilis and kind of issues. We do scan. And then we start thinking about whether the person has dementia or not. As I said before, these are the risk factors for dementia, like stroke, heart diseases, cholesterol, diabetes, Parkinson's disease. The most commonest is the genetic cause. For example, a father has dementia, then the risk of having one of the child is is slightly higher as compared to someone's parents don't have dementia. But that doesn't mean that the person whose parents have dementia will develop dementia, not necessarily. So the risk is a little bit higher. So as someone was asking hearing loss, so it is important that we consider and we rule out hearing loss. And social isolation, I mentioned that because it's very important. That's depression, where you don't have people to talk, where you're so low in the mood, then that gets into depression and slowly increases the risk of depression. Yeah, so it's important. As I said before, smoking is a killer. Smoking is a killer. Drinking alcohol is a killer if it is beyond certain units per week as recommended by the government. Physical activity again, and this is another common thing that we have noticed is in boxers, repeated head injuries that can be seen. Lack of physical exercises, poor diet, especially lots of Asians who are vegetarians. I always promote to take some supplements. Very, very important, having supplements, vitamin B12 supplements. Please have it. Please have vitamin D. Vitamin D is like a universal drug, you just take in this country, everyone takes it because we don't expose ourselves to sun. So we do need to take all the supplements. Vegetarians, I please ask everyone, get your blood tested. Let's check your vitamin B12. And if you're less deficient, please make sure you get into it. Folic acid is also very important, very, very important. It's not just in females, pregnant women, no. It's important for all of us, especially vegetarians, whosoever is listening, vegetarians, folic acid, please remember, get your folic acid level checked, important. Okay, how to seek help, someone was asking. Yes, that's the first step is like recognize. You won't recognize, most often you won't recognize at all. I have not had anyone saying that, doctor, possibly I'm having dementia, can you please check? No one does that. Is either the wife dragging them or the husband dragging them, or a father or a sister or brother or someone dragging them to the clinic, where I've not had anyone walking through the clinic saying that I've got dementia or like, please check for dementia. So that's first and foremost. And then we have a type of dementia. And based on that, we have 3 types of things that we do. And once we diagnose dementia, we have a carers group. And we put them into something called as a dementia care pathway, where they get appropriate help in terms of meeting people with dementia or meeting families with dementia, how to manage it, and we give all the leaflets that's relevant for them so that they can contact the right people at the right time. Important is treatment. And in treatment, we have 3 modes. In medicine, always 3 modes is very important. First mode is medications. Second mode is psychological. Third mode is social. In dementia, we use some medications called donepezil, memantine, galantamine, rivastigmine. These are the common medications. However, just recently, FDA has approved a new medication, which will take at least next 5 to 10 years to come to UK. They say it is quite effective in Alzheimer's and mixed dementia. So let's hope that we will live longer. Hopefully, by the time I reach 70, 80, if at all, then possibly it'll be ready by then. So yeah, so that's the way it is. Whatever it is, manage blood sugar, manage cholesterol, manage diabetes, stop smoking if you're smoking today, and eat healthy. Very important. Psychological. We usually refer to teams about talking about life, talking about past, and we were talking about orientation to their place. We talked about reminiscence therapy, which is very commonly we do it in care homes, where if you go, I don't know how many people have visited care homes. If you go to a care home, it will look quite old. If new posh, very rich care homes, if you go, they will have a cinema, and the cinema all the time they will be playing 1960s movies or 1950s movies. They will play. They don't play the new movie. What are they called? Whatever the new English movies are, they don't play them. They'll play Roger Moore movies, and so many English actors. I don't remember their names. Sorry, but all movies are old, and they'll have photos when they're in 20s and 30s, but not later. And in their rooms, probably they'll have a picture of the family. So these are all important for them to kind of make them feel that they are oriented within time, place. And social, very important, keep them active all the time. And, I always say to people, don't retire. Either retire, I don't know what the definition of retirement means, always work, keep continuous working, but no stress. Less stress, zero stress is important. Work, do some exercises, adapt yourself, and play some games like chess, like Sudoku. These are all like brain stimulations that will help you. So retirement, that doesn't mean put your feet up and watch television. No, that's dangerous. That's a killer. Yes, you can do it now and then. Important is keep yourself very active. That's what is the best. Yeah, so these are the things that you could do. Use a diary to remember appointments and who you see. Most of the patients I see, they have a whiteboard in their house, and then they write there who is coming. The son, they say son dash Mr. Smith, daughter Lily, grandson, they write the names. So when they enter the house, they say, okay, see, this is me and this is me, because it's written, so they will remember. So these are the ways also for them to orient themselves to who they are. Yeah, as I said, always important, stay family. Family is the best, friends is the best, socialization is the must. Always. So our life is going so fast that we are forgetting friends, we are forgetting family, we are forgetting other, socialization. Tell you what, this is the one which is going to save you at the end. So please don't miss it now. Please stay connected with your friends. Please stay connected with your family, which is very, very, very important. Money is not important in life. Yes, it is some part of it, but important is family, important is friends. Socialization is very important. These are the people who are going to keep you alive, keep you happy all your life, not money. So please make sure that you get help from families, stay in touch with family. And, if you believe in spirituality, please do continue with that. These are the things that will help you to keep safe and sane all your life. Yes, very important. All of us need to do this. If at all we are coming to a stage, a little bit later, please think about doing will. Please think about lasting power of attorney. Very, very important, because I'm a special visitor for Office of Public Guardian. Trust me, I know some of the people who are here, they know how many difficult patients I see. They literally fight. Family members, when it comes to money, they literally fight. They swear at each other because of your money. So make sure that you do a proper will, make sure you do a proper lasting power of attorney, so that your property, your money is appropriately designated to which person and when. If not, everyone will be cursing you. Everyone wants to come and beat you. Everyone wants to take every piece of you. Yeah, so make sure these three things are, the two things especially, are done. And driving, obviously, DVLA will decide whether you are able to drive or not. Yes, these are the few places where you can always seek advice irrespective of your GP, because GPs are very busy. Sorry, Meera. So you can call up Alzheimer's Society if someone is having some memory issues. They will guide you. Age UK is a fantastic charity organization. Carers UK is a fantastic, and obviously CAB. CAB is like a paracetamol for everything. CAB, you go for CAB, you go for CAB. Well, how much can you go for CAB? So go specific to these places. You'll get appropriate help. So that is it, mine. But thank you very much, guys. Please ask me any questions if you have. I don't know, Meera, if we have any time, please ask any questions if we may have.
I think actually you've covered a lot of questions that have come through, especially along the idea of treatment and support. There's a few questions perhaps we could quickly go over before we close. There was a question on vaccines. Is there a vaccine for dementia?
As far as I'm aware, as of today, which is what day today is, 23rd? No. But I'm sure, a lot of, there has been lots of trials on this, and they're working very aggressively in America. And I think recently I did read about a vaccine, but I'm not sure how effective that is, but it's not FDA approved yet. No.
Perfect. Do people with ADHD, are they more prone to dementia at a later age?
That's a brilliant question, because I'm a specialist in ADHD too. We don't have enough research in that. ADHD is a new thing in the last 10 years, so we don't have enough research into it. I did had a very interesting question, because I had a patient when I was running ADHD dementia service who came to my clinic at the age of 73, and then when I assessed him, he didn't have dementia. In fact, he had ADHD. So I had to refer him back to the ADHD specialist, because at that time I was wearing a dementia specialist hat, so I couldn't treat him, but I could recognize that he's got ADHD. But answer to your question, possibly I may have to wait a bit longer to associate together.
Thank you. How quickly does dementia progress to the advanced stage?
Yeah, that's again a beautiful question. As I said before, it all depends upon multiple factors. I have seen someone who's been diagnosed with dementia at the age of 62, 63, and they've been fantastically doing well, even at the age of 70, 73. I've seen someone who's been diagnosed with dementia at 69, and they have died by 72. So a lot of factors play into picture, very important skills, daily work, playing Sudoku, chess, family is important. I always say family, friends, have life, have love, have laugh. These are all important. Keep away from drugs, keep away from smoke, keep away from alcohol. Well, it's a culture in some people drinking a little bit of alcohol. It is okay, let them enjoy, but not to more than what is needed. And diabetes, cholesterol, very, very important. And hypertension, very, very important. Important falls, very, very important. More falls, worsening of dementia very high. More hospital admissions, worsening of dementia is very high. More infections, worsening of dementia high. So if a person has none of this, they live longer. If person has multiple of these things, their symptoms, they get worse very quick.
Thank you. There's a question around yearly testing to be sort of proactively picking up patients or identifying dementia. Is there anything out there that can provide that service?
That's, I'm sure, GP services, Meera, you can answer that question.
No. I'm posing it to you. Unfortunately, not really. I think if you're developing some of those signs and symptoms, then we're happy to see you and discuss and perhaps think about further testing. There are basic kind of questionnaires we can do in GP, and then we can refer onwards, but there's no sort of proactive reviews. We do frailty reviews, so picking up patients who are over 65, exactly as you explained, patients with recurrent falls, infections, and recurrent admissions, and those people are at risk, and actually they should be checked annually by a GP through the long-term conditions pathway. But that's the way those patients tend to be picked up.
Possibly that person is asking quite a common question I do come across, that for example, my dad had dementia. Will I get dementia? And if I get dementia, how will I get tested now? You know, at the age of 45, will I get dementia? How would I get? Is there a test available? This is a very common question that comes. No, there's no test for it. Yes, genetics do play a huge role in it, but it's something that I can't help you with. But what I can advise you is eat healthy, do regular exercises, don't smoke, keep away from laddus, and keep away from diabetes, keep away from Indian sweets. You'll be fine. I'm saying to myself because I am quite addict of Indian sweets. That's why I'm saying. So keep away, be healthy, and you will live longer.
Amazing. Thank you. And we had a really lovely comment from Jayshree, who sings bhajans to her mum, and that really helps. And actually, there's lots of Seva services in care homes where we can go in and sing bhajans, and actually it's a really uplifting opportunity for service and great for the patients.
Absolutely.
I think that's what we've got time for. We've had a thank you actually from Mahesh Uncle. Excellent eye-opening presentation. Dr. Raj has covered a number of useful aspects, and it's helpful for all of us to know about dementia, and we should organise more of these sessions. I completely concur, and I've learned lots as well, and thank you so much for sharing all of your case studies and stories too. So was there anything else you wanted to say, Dr. Krishnaiah?
No, I'm absolutely fine. Thank you very much. It was a pleasure having a conversation like this. And I'm sorry there were some itches because I'm not very tech savvy, but my wife in the background, she's first trying to help me. Well, I should be, but I think I will be over a period of time. But thank you very much, everyone, listening to me, and hope to meet again in some other talk.
Thank you. And thank you to Dr. Upadhyaya, to Seshan, the media team, to Gayatri Aunty, to Dr. Krishnaiah. And thank you, Swami, for arranging such a wonderful presentation as well. So we'd like to conclude now with 1 Om and 3 Shantis. Om Shanti, Shanti, Shanti.